Hello, doctors. Today what I want to talk a little bit about is how Spinal Kinetics helps doctors to increase their professionalism, helps to increase their credibility. So let's define credibility. Credibility is your basic ability to be looked upon as a trusted source of something. Somebody that's credible is trusted and convincing. They can be trusted. Okay, when we talk about professionalism, all we're talking about is the antithesis of being an amateur. So let's define what an amateur is. An amateur usually does things with not a lot of skill. So they've really not advanced their skill levels. That's what amateurs do. Professionals advance their skill levels. So let's talk about the skill level within the market of a spinal injury. Spinal injuries are the #1, #4, and 6th leading cause of chronic pain and disability in the world today. They're some of the most expensive injuries in the market today. And one of the things that I'm most excited about, the most happy about, that Spinal Kinetics does is helps to elevate the professionalism in the market. Whether we're working with a chiropractor, we're working with a pain management specialist, we're working with a surgeon, we're working with a general practitioner, we're working with a doctor of PT, we're working with a naturopath, we're working with a physician's assistant. That's working with injuries, it doesn't matter. We're going to increase the professionalism. Now, how do we increase the professionalism? Well, one, we bring awareness to the fact that you want to have a skill set in the actual ability to diagnose and determine how badly damaged the spine is. The most problematic spinal injuries that there are, the most common injuries that there are spinal ligament injuries. So we help the doctor to increase their professionalism, understanding, and their skill set in this particular area. Now, once they understand how to diagnose it, their skill set and skills in being able to treat it are going to go hand in hand. It may not be at first, because a lot of times when doctors come into Spinal Kinetics, one of the things we hear the most is they're shocked at how much damage there really is with these patients that they had no idea of prior to starting to test. So the first step is knowing what's there. The second step then is really educating yourself and starting to increase your competency on what you should be doing for these injuries. But the professionalism and the increase in professionalism, when we have somebody that really understands spinal ligament injuries, those doctors can talk with any doctor, with a neurologist, or orthopedist, the pain management specialist. I mean, an excessive motion study is going to allow you to grade the sprain. It's going to allow you to determine whether or not you have a surgical level of excessive motion caused to the non-disc ligaments. You don't have to have a disc herniation to have a surgical level of ligament damage here. It causes you to understand that you have a permanent injury, and if you want to have an impairment associated with it, you can get it. It causes you to understand whether you should have an activity restriction for a patient. And if any of you are not understanding what I'm talking about right now, we have a CRMA provider interpretation guide that you can call our office and get, right? So where there's excessive motion, you have facet injury. So it allows you to be able to determine how badly damaged these facets may be. It also allows you to determine if the upper cervical is damaged, how damaged is the upper cervical. And remember, those upper cervical ligament injuries will mimic every single symptom of a mild traumatic brain injury. There's a lot of crossover in that particular area, and it happens to be one of the main conditions that have not addressed that patient who is supposedly suffering from just a mild traumatic brain injury is not going to fully recover, right? So it also allows me to determine on a more higher probability whether the person has a disc herniation or not. And it also allows me to rule that that disc herniation was caused by that particular trauma, because the energy has to go through other tissues before it gets to the disc. So if all you have is a disc herniation, but you don't have the other tissue damage, you have an undetermined pre-existing condition. It's ruled a pre-existing condition until proven otherwise. You have all of that with a Spinal Kinetics test, with the doctors that understand these tests. In my experience, the doctors that understand ligaments and how to test for them, not just the disc herniation, but also for the non-disc. Because remember, you're picking up most offices that are going to treat spinal injuries are going to be capable, the really good ones are going to be capable of treating not only the severe problems that are found in MRI, but the even more severe problems that are not found in MRI. And so that's what increases their credibility. That's what increases their professionalism. Being able to say, well, look, the person has 3.7 millimeters of translation at C4 and C5, and they're qualified under Cigna, Aetna, Blue Cross Blue Shield, EviCore, and many other surgical guidelines in general health care, is a way to show this is the significance of the injury. But then that provider also has to understand what their treatment's doing to alleviate that. What their treatment's doing, because there's confusion in the market. If something is permanent, why would you treat it? You treat it to address the other factors around the permanent condition. If a person has a 10% compression fracture, they're never going to lose that 10% compression fracture, but no one's going to look at it and say, wow, you just said we're in a bad accident, we have a 10% compression fracture, and so it's permanent, so there's no treatment available to you, to try to influence any other factor that would get you out of pain. Right? So of course you're going to treat the other factors that can be enhanced, that can be treated around a permanent injury to try to get the patient successfully resolved from whatever symptoms that permanent condition is causing. Now, when you understand that, you've elevated your professionalism in the spinal injury market. Okay, the level of amateurism in the spinal injury market is evident by the results of the patient results. If a patient has a spinal injury, by research, 55% or more are never going to fully recover, and the or more is very common. So if we have a condition that the doctors are treating, but they're not getting resolution of the condition, then maybe there's something that's being missed, and that's what I'm very proud of that Spinal Kinetics brings to the market. We're bringing to the market a significant injury, a significant condition that, if overlooked, can cause the patient to not have the benefit of results that they may have had working with a highly professional doctor that understands this condition. And those doctors should be some of the highest, they should be the busiest and perhaps the highest paid doctors in the market today. The higher the professionalism, the higher the results, usually the higher the income.